Hello, today is the final journal assignment, and I will be discussing and answering some questions. First, I would like to discuss some of my goals at the beginning of the semester. A particular goal that I did have was to help strengthen some of my clinical assessment skills. One of that was major because I have done assessments in the past as a nurse, but as a nurse, it is different as working as a clinician or therapist or a nurse practitioner. So it was very significant for me to be able to do that and be able to enhance my ability to build a good rapport with patients and to develop a deeper understanding of how culture and individual factors can influence one's mental health. When discussing feelings of prejudice and biases during clinical experience, I do feel that a lot of that would be related to some of the patients who were having some substance abuse problems, and it had been so persistent for so many years, yet they kept trying over and over again. So sometimes I did feel like, do they really want to do this, or are they doing this because they're doing it because they don't want to have to lose their job or don't want to go to jail? Because there are some patients who were facing prison charges and cases, and they didn't want to go to prison, so they were in therapy for that. So those were some of my biases, and some ways to help me manage it was speaking with some of the other there were other students there as well as my preceptor and other clinicians that were there, just getting their input. And sometimes that was the case. Some patients really didn't want to be there, and there were some patients that did. So, of course, it's significant and important to treat them all the same because you can't tell the difference. And your job is just to be professional. When managing my anxiety and self doubt and uncertainty, I would do more research. Did more patient chart review patient chart reviews. I'm trying to be more mindful myself, and getting support once again from my colleagues. My insights that were developed during clinical experience, I gained a profound appreciation for the importance of building trust and creating a safe space for patients. Like I said, every patient has a different situation, and it was very significant for them to feel comfortable. Sometimes they don't know if they're going to come to a group therapy session or and run into a patient of someone else they know in a personal life, or if they want to even be in a group therapy session and it could be somebody that they knew. So it's very important for them to feel comfortable, to feel safe, because a lot of times patients, that's why they're not open to therapy, because they're wondering about what other people are going to think. So it was significant for them to understand that everything they were doing was for the better of them, and for us to make them feel that way. um as for impact on reflective practice, I would say it helped me to identify areas that I needed to grow in. And that would be not having biases, of course, and being prejudiced to having prejudices to those patients who I may have personally felt like didn't really care, because it wasn't about what I personally thought. It was about the patient the whole time. It helped me to identify areas of growth, like recognizing unconscious biases, celebrating my success, which was great, which is noticing the difference of when I started and when I ended, and how much more comfortable I felt and how much more knowledge I felt like I had. And I will say this did boost my confidence. As a student, I think I got a better understanding of theoretical concepts as well by connecting them to some real life scenarios. Um, when continuing reflections in future practice, I absolutely plan to continue using reflection in my practice. It provides, because I do plan to have my own practice one day. It provides an invaluable tool for continuous learning and personal growth. Journaling after cases, I loved it. I did. Every time we do this, I love this, because sometimes I don't even know what I'm thinking in my mind, or what I feel like I've accomplished. And then to have to answer these questions, I'm like, okay, so I did learn something new, or I did gain something, or I do feel like I'm better at what I started out. I feel like I learned a lot more from when I first started. Um, Also, seeking peer feedback. That journaling helped with that, and engaging with my supervisor. I love that more than anything. The preceptor, she was very helpful. She was a very nice lady. She was very professional, and any question I had, even if she didn't know the answer right away, she would do the research that it took for me to get the comfort that I needed and what I was doing. I feel like reflection ensures that you are adapting and that you are self-aware, as well as committed to providing the best possible care to patients. And that about sums it up. Everything was great. I appreciate this entire experience. Every reflection, I feel like just going back looking at them, I learned something, and I feel like I gained something, and I plan to be the best that I can be in the future. Thank you.